Hey everyone, I'm Sam Alcaine and welcome to our food safety office hours. I just got back from a wedding and HPAI kind of feels like the cousin who brought a surprise plus one, but is at least behaving on the dance floor right now. So I'm unhappy about the extra bill, but for most of the guests, the party has kind of stayed on track. And since our last, kind of HPAI meeting in June here on the office hours, the number of states with confirmed positive herds has gone up from 9 to 13 and the total positive herds have more than doubled, but we'll touch a little bit on that later. We've also had a number of human cases, 4 in Colorado dairy workers, but then it went to the birds and we saw another 10 in poultry workers. So that has been kind of a new twist in the HPAI AI story. All of them have had mild symptoms though, and there hasn't been any secondary spread. We've also begun to see some more studies on H5N1 stability in milk, and we're going to touch on some of that today. And then we're also going to talk a little bit about the overall impact that H5N1 and HPAI AI have had on the industry thus far with our panel today. And so joining us, we're going to have Dr. Matthew MacLachlan, who is an assistant professor in the Department of Population Medicine and Diagnostic Services here at Cornell. We've got Dr. Diego Diel, who's an associate professor also in the Department of Population Medicine and Diagnostic Services, and he's the director of the virology laboratory at the Animal Health Diagnostic Center here. We've got Dr. Robert Lynch, who is a dairy herd health and management specialist in the Department of Animal Science, working with ProDairy. We'll also have Dr. Nicole Martin, who is an assistant research professor and the director of the Milk Quality Improvement Program in the Department of Food Science, and myself. So as you think of questions, feel free to put them in the chat box. And we'll start off the day with me kind of just giving an overview on the state of the glass thus far. And then I'll hand it over to Diego to talk a little bit about some of the results coming out of his lab. And then we'll go to Matt on the economic analysis. So with that, let me share my screen. And so state of the glass. All right, so since I pulled up the data this morning coming out of USDA on the positive herds around the country, and so since the beginning of the outbreak, we've had 13 states with confirmed herds, with 190 of those, with 190 herds confirmed. In the last 30 days, though, you can see it's really kind of dropped off. We only have 5 states with positive herds. And most of that activity is going in on Colorado. Most of these states only now have like 1 or 2 positive herds. So what's going on there? An interesting thing in Colorado is that after they started having those positive workers, they implemented mandatory testing for the bulk raw milk tanks on farm. And so they have found a lot more positive herds than other states where there isn't that active testing. So I think it's around 63 farms have come back positive in Colorado, and they have just a little over 100, right? So almost half their farms have been positive at some point in this outbreak. What does that tell us then about the real situation? I think it's an open question, but it does suggest again that probably the prevalence in states where there isn't mandatory bulk milk testing is probably higher than what we're actually seeing reported. But only time will really tell. And further testing. Now, back when we met in June, we had already kind of talked about FDA's commercial milk survey, where they had went out into retail. They sampled at least 300 products that were processed in 38 states, and roughly 20% of those positives came back positive via PCR. But when they did the testing for infectious virus via the egg assay, none of them came back positive, which is kind of a verification of pasteurization. They have just finished in June and July. They did a similar study. It wasn't as many samples, about 197, so almost 200. And I think the story was basically the same. We're going to wait to see what they actually publish, but they found no infectious virus in any of the products that they sampled, and they expand their product testing. So it wasn't just fluid milk, yogurt, and cottage cheese. They also put in ice cream, and they also tested some raw milk cheese samples. And so none of those had infectious virus. About 25% of the samples were positive via PCR. So there is still, right, even in June and July, there is some background level, but the distribution of those samples is not clear right now. And so it's really hard to compare that to the previous study, but it does suggest, right, there is some background high path AI in the milk supply, but right, pasteurization is doing a great job of taking care of that. And again, just for a reminder, right, what are our main controls, right, to ensure a safe milk supply is one, we're not going to be collecting milk from obviously sick animals, and then two was pasteurization. And there have been some studies, right, going on to look at, validating that pasteurization is effective for control of high path AI. Last time we met, there had been that discussion on a study that came out of the University of Wisconsin-Madison, which had some interesting residual activity in some of the samples tested at 72C for greater than 15 seconds. But those were done on a thermocycler and not on a system kind of resembling what we do in industry, so a continuous flow system. Since then, FDA has put out their study on thermal inactivation of H5N1 using a more commercially similar process. So they use this microthermics unit here that you see in the picture, right, which has a coil system and allows them to do continuous flow. Here they use an H5N1 strain that was isolated from turkeys, but it's from the same clade as the cow strains that we've seen. And the overall takeaway was that after pasteurization, they found no infectious virus. And in fact, they weren't even able to find infectious virus when they were taking samples from the come up tubes, right, to warm up the milk to pasteurization conditions. And what they were doing here, the table here on the bottom right, is that the titer of the H5N1 that they were using was around a little over 6.5 logs. And again, they were seeing then no detectable virus via the egg assay after, right, standard pasteurization conditions. Again, showing that pasteurization is pretty effective, well, not pretty, is effective, right, at reducing the virus. Now, because they didn't have any detectable virus, we still don't know the D and Z values for the virus for thermal inactivation, though they did estimate, and I don't quite know how the FDA came to this number, but they estimated that there was roughly a 12 log reduction in the viral load based on what they saw. Now, we'll have to see what other studies come to, but that's what they were saying. Another interesting thing that they did in the study is that they did do some raw milk bulk tank testing from some areas, and what they found there was that the average level of the virus in positive bulk milk tanks, raw milk tanks, right, was around 3.5 logs, though they range from 1.3 to 6.3. But again, just kind of showing that the load of virus that we're seeing in the raw milk tanks that then goes to processing is well below, right, the ability of pasteurization to deal with. So again, just building further confidence in the control measures that we have in place there. And then there's some other studies coming out that in a little bit, I'll pass over to Diego. He'll talk about some of the work that we're seeing here on other thermal inactivation conditions. Talking about transmission, I'll just put this out there. USDA did a study on some of the farms in Michigan to try to understand how H5N1 was being transmitted between the farms and between not just dairy farms, but also poultry farms. And the high level takeaway was that in USDA's opinion, from what they saw, they didn't really think that it was spillover into the wildlife and then getting reintroduced on another farm, that they thought really that the routes of transmission were through surfaces, whether it was hard surfaces like equipment, so wheels, stainless steel, and things like that, and then also potentially through clothing or boots that were on people, because what they found was that there was a number of pieces of equipment that traveled between farms, and also a number of workers that were not only working on dairy farms, but also working on these poultry farms. And so that's kind of what they were highlighting out of that study as what they thought was one of the key routes of transmission, and why it's then so important to kind of build a barrier around the farm when it comes to equipment and people to then kind of prevent the transmission between farms. Yes, the initial introduction, right, was through cows, moved from one farm to another, but after that, that subsequent transmission is what they were pointing to. Again, we'll wait to see if other studies and like what's going on in Colorado, does that bear out the same way or not? we'll wait to see. This is just one study. But it does, right, indicate some potential then intervention strategies we could have to cut down transmission. Now, what about on-farm transmission? There was another study out of Emory where they were looking at the survival of H5N1 on different surfaces. So the inflation liners, right? These kind of rubbery liners that are used to milk the cows, and then stainless steel. And the takeaway here was that the virus does survive on both these surfaces for a few hours. And so you could then easily see that, milking equipment could potentially transmit the virus from one cow to the other. So there might be another route of, it is really hard to clean the milking equipment in between each cow, especially on these hard farm or on these large farms. But there might be another intervention strategy there. But if not, right, it again notes that it may be more difficult to control transmission once it's on a farm between cows. But we have other potential intervention strategies to mitigate the transmission from farm to farm. So we'll see how that pans out. It looks like things are winding down this season. We'll see what happens next year. On the raw milk front, again, FDA is still has always recommended that we do not drink raw milk. We saw some cases, right, in cats where they were fed raw milk. Cats got sick and died. That study out of Wisconsin also fed raw milk or infected milk to mice. They got sick. We're also seeing CDC has published since the last time we met a study on ferrets where they had some H5N1 viral isolates from the Texas, and they gave it to ferrets. 6 out of 6 of the ferrets that were given the virus died. They have cages where there were ferrets that were not given the virus but came in close contact with the ferrets that were. All 3 of those contracted the virus and died. And then they have ferrets that are in separate cages, but there's like a ventilation tubing between them to kind of allow what you might call respiratory droplet transmission. And 1 out of 3 of those ferrets contracted the virus. So it's not, it can be spread through respiratory droplets. It looks like in these conditions, though not all the ferrets contracted it. So it's not super spread through respiratory, but it is spread through direct contact. And so that was interesting. They have just done a test with isolates from Michigan, and my understanding is that they behaved a little bit differently. There is still spread, but it doesn't seem like it is as lethal as the Texas isolate. So it'll be interesting to see what are the differences between the isolates found in Michigan versus those in Texas, and what drives that change in infectivity and then severity of disease. There's still a lot of work coming on raw milk cheeses. We still don't know, right, how well the virus survives, and this I'll just kind of go on to what is then the ongoing work. There's ongoing work looking at thermization trials. So what are some time and temperature conditions that might not be, right, pasteurization, but are used by raw milk cheese producers to treat their milk? Are those sufficient to inactivate the virus? And Diego will touch on some of those. Some further validation of continuous flow pasteurization. We're starting studies on raw milk cheese aging to see whether or not the virus is inactivated over time in those cheeses. Also, how do we deal with contaminated milk on farm? Are there non-thermal decontamination methods, whether that's acidification or different types of sanitizers? There's some risk assessment models going on in there, and then also looking at other dairy matrices. So that's some of the ongoing work going on here at Cornell and other centers around the country. And with that, I'll pass it over to Diego to kind of give an update on some of the work coming out of his lab.
Thank you, Sam. And good afternoon, everyone. Let me just try to share my slides here. Okay, can you see my slides?
Right now, it's just showing the whole thing. So let's see what happens. Yep, perfect.
Okay, perfect. So thanks for the invite, Sam and Alex. I'm just gonna go over some of the results that we we have been working collaboratively with different people here at Cornell, at Carl's, Sam, Nicole, and Al are some of them working on the milk safety side of things, and then we have also been working with Dr. Daryl Van Nydem and Matt MacLachlan and Alicia Fry on assessing the economic impact in dairy cows. I'm just going to touch a little bit on some of the studies and data that we have. Just a recap, this is published data that, on some of our initial investigations on these outbreaks, or, following the spillover of the virus into dairy cattle, showing, pretty significant viral loads in milk, especially when we compare milk with the other, clinical samples that we tested, including nasal swabs, whole blood, serum, urine, and feces. It's pretty evident that a lot of the virus that is being shed and by infected animals is actually being shed by milk. That's also compatible with viral loads that we detected in the tissue when we looked at the viral loads in mammary gland and compared that to the lung, lymph nodes, and small intestine and large intestine. We can clearly see that there's a pretty significant difference in the viral load in the mammary gland, much higher than in other tissues. These animals are also shedding infectious virus, so we detected very high shedding or titers of virus in milk from infected animals, titers varying from about 4 to up to 8.8 logs of infectious virus being shed in per ml of milk from those infected animals. And again, that shedding in milk corresponds to high viral loads of infectious virus in the mammary gland from those infected animals. And obviously, when we and others learned about this, there was pretty obvious concerns about the food safety and public health concerns because of the amount of virus that these infected animals were shedding. So we, together with Sam and Nicole, decided to start running some studies here at Cornell to assess different temperature treatment conditions on their and assessing their efficacy on inactivating the virus in raw milk. The data that I'm showing in this slide is basically just a decay of the virus, where we monitored and tested milk samples over time that were just maintained at different temperatures. You can see that we tested we maintained infected milk samples at 4 degrees, 20 degrees, 30 degrees, or 37 degrees Celsius, as shown in these graphs. And you can see that the virus is relatively stable at 4 degrees. We were able to detect infectious virus up to day 56 post incubation of this infected milk at 4 degrees. When we looked at 20 degrees Celsius, we detected infectious virus up to day 7. After day 7, most of the samples were negative, and we no longer detected infectious virus. When we increase the temperatures to 30 or 37 degrees, the decay is much faster. At 30 degrees, we detected infectious virus up to day 5 post incubation. And then after that, we no longer detected infectious virus. And at 37 degrees, we only detected infectious virus, within 24 hours. On day 2, post incubation, we were no longer able to detect or recover infectious virus from these samples. So using these data points, we calculate the D value, which is basically the the time that is required to inactivate 90% of the virus at these different temperatures. And as you can see, at 4 degrees, the time that is required to decrease 90% or inactivate 90% of the virus is about 12.6 days. 20 degrees, that drops to 2.5 days. 30 degrees is 1.1 day, and then at 37 degrees is less than a day, 0.34 days. Those are the values that we were able to calculate with these studies. So it seems like the virus is quite stable actually at refrigeration temperature. So, Sam mentioned earlier regarding the FDA guidelines about raw milk consumption. I think that this data really highlights the risk that consumption of raw milk actually poses to public health and to animal health as well. If that milk is fed to animals is maintained at 4 degrees, the virus will remain stable and infectious on at that temperature for quite a while. So we also looked into effectiveness of pasteurization temperatures, different conditions. We tested infected milk samples at 60 degrees for 10 minutes, 63 degrees for 30 minutes, and 72 degrees for 15 seconds. These are the most commonly used temperatures for pasteurization. As shown in these figures here, our control untreated milk samples, we detected a lot of infectious virus. So the red shown in this image here represents infectious virus being detected in cell culture. When we treated the samples at 60 degrees for 10 minutes, 63 for 30 minutes, or 72 degrees for 15 seconds, we did not detect infectious virus in cell culture. We then ran titrations on those samples, and as shown in these graphs, only our negative untreated control is where we detected infectious virus. All the treated samples, we did not detect infectious virus. These results here on panel C represent data that we obtained in cell culture in vitro. We also did egg inoculation, which is a more sensitive method, and that really confirmed the efficacy of these temperatures or treatment conditions in inactivating the virus. This set of experiments was actually conducted with with milk from clinically affected cows that we received from the field. We also conducted experiments where we spiked the virus in raw milk samples, and we obtained very similar results. So the heat treatment completely inactivated the virus that we spiked in those milk samples. Again, confirming the efficacy of the pasteurization temperatures in inactivating the virus. So these experiments were conducted with two different instruments. We performed the experiments in using a thermal cycler, which is what Sam mentioned earlier in one of the earlier studies. They also used a thermal cycler, and we also conducted a study on a submerged coil system, which basically it more closely resembles an actual pasteurizer to perform these experiments, and we obtained the same results where the heat treatment efficiently inactivated the virus. In this graph here, I just want to show you, in addition, so this is the same data that I showed you earlier in terms of infectivity. When we looked at cell culture, those temperatures are efficient in inactivating the virus. When we looked at the embryonated egg system, we also were able to efficiently inactivate the viruses at these temperatures. When we performed PCR on the same milk samples to look for viral nucleic acid, you can see that we still detect pretty high and stable levels of viral RNA in those milk samples. So the nucleic acid is present in those spike milk samples or clinical milk samples, but the heat treatment is effective in inactivating the virus. So this also goes along with the data that was published by FDA, where they did detect viral nucleic acid in shelf products, but were not able to detect infectious virus or recover infectious virus from those samples after pasteurization. We also tested a few, variations of the temperatures. So just another slide here with more temperatures that we tested. So we also tested the efficacy of heating the milk at 50 degrees for 10 minutes, 63 degrees for 22 seconds, or 69 degrees for 22 seconds. As shown in this immunofluorescence image, you can see that 50 degrees for 10 minutes was not sufficient to completely inactivate the virus, as we are seeing some red cells here indicating viral replication. When we looked at 63 degrees for 22 seconds or 69 degrees for 22 seconds, those conditions were, again, sufficient to completely inactivate the virus. If we look at the titers recovered from those treatment conditions, you can see that at 50 degrees, even when incubating for 10 minutes, we do see a drop in viral titer, but that's not sufficient to inactivate. So we do see, about a log and a half to 2 log reduction in infectivity when treated at 50 degrees, but there's still viable and infectious virus at that temperature condition. When, at 63 and 69 degrees for 22 seconds is sufficient to completely inactivate. Again, this is infectious virus in cell culture and then in embryonated eggs, confirming the results. And when we look at the viral RNA loads in those samples, we again see that that's pretty stable. We still detect viral RNA even after the heat treatment of those samples. So this is what I had to present on in terms of the inactivation studies that we're conducting. This is we're wrapping up these studies in raw milk now. We're moving into the next phase where we're going to be looking at raw milk cheeses and evaluating the aging process or the effect of aging process in the inactivation of the virus. And I just want to wrap up with a couple of additional slides. And this is a project that we are working with Dr. Daryl Van Nydam, Matt MacLachlan, and Alicia Fry, and Felipe Mosca, who is a postdoc in Dr. Van Nydam's lab, to look at the impact of these outbreaks in production and also in the economic cost of the outbreak. I'm not going to touch on the economic side of it. Maybe Matt will brief you on that. I'm just going to show you what are the consequences of this in terms of productivity in an affected farm. So here, just a refresher again from one of our earlier studies on this clinical sign. These are affected animals from an affected farm presenting mild respiratory signs, lethargy, and one of the most marked clinical signs that is observed in these animals is involution of the udder, and this leads to milk with poor quality, that it's yellowish, looking like colostrum, and in some of the milk samples you can even see curdling of the milk that is being secreted by those affected cows, and all of that is a result of the virus replication in the mammary gland. This is histology of the mammary gland showing very severe mastitis that is induced by this virus, as the virus basically target the milk secreting cells in the mammary gland. And these images here are just showing staining for the viral RNA or viral proteins in those milk secreting cells in the mammary gland. So that replication of the virus in this organ basically leads to all these alterations in milk and also in the other health of the infected animals. And this is, I think, is my last slide, just to show some of the work that we are currently doing on assessing the impact on this on milk production in affected farms. This is a study that was conducted in a farm that has or had 38, about 3,800 lactating cows at the time of the outbreak. This is just a daily incidence curve showing that the outbreak, and this is a number of clinical cases by day. This farm, the beginning of the outbreak was detected on March 19, and the first clinical case was detected in March 19, and the last clinical case was detected on April 13. So it's about 3.5 weeks in which these animals were, being affected, and new cases were observed in that farm. When that data was overlaid with some of the clinical features that were described in these cows, especially rumination time, you can see that there is a pretty clear overlap between. So the red line in this case represents the clinically affected cows in this farm, and then the teal line represents the non-clinical cows in that farm. You can see that the clinical cows clearly had a significant reduction in rumination time, and we had about 777 cows affected in this particular farm. So it's a pretty significant drop when compared to the non-clinical animals on that farm. And we also looked at individual and daily milk production by those animals. Again, the teal line represents the non-clinical animals. They basically maintained milk production throughout the time that we monitor these animals. And I wanted to point out that we monitor these animals for about 60 days after the beginning of the outbreak. And when we look at the milk production, daily milk production by those affected cows, you can clearly see that they present a very marked, significant drop in milk production during the clinical course of the outbreak. And that milk production basically never goes back to normal levels or pre-outbreak levels. So this represents a pretty significant cost to the producer, because those animals, they are eating the same amount as they were prior to the clinical outbreak, and they never return to the production levels that they were producing before they were infected with flu. So we are looking into additional details of this analysis. I just wanted to share this with you, and I think Matt is doing a very detailed economical analysis of this to look at costs related to drop in milk production, and also herd removal, which is another feature that is observed in those affected farms. With that, I'm going to stop here. I just wanted to thank Nicole, Sam, and Al for their collaboration on the milk safety studies. Mohammed and Lena actually are from my lab. They're the two people that are actually doing all the work in the BSL-3 lab, and this is not an easy task to get this work done. And they have worked many hours in the last few months to get all the results done. And then Daryl, Felipe, Alicia, and Matt for their collaboration on the impact on dairy roosters. I also wanted to thank the Cornell Teaching Dairy Barn for providing all the raw milk for these studies. It's very nice to have a farm here on campus where we can actually get the milk and conduct these studies. And then funding for the pasteurization studies actually provided by the New York State Ag and Markets. And without that support, we wouldn't be able to have completed these studies that we have completed so far, and the ones that we are moving into, including looking at the raw milk cheese. And with that, I'm going to stop here and pass it on to Sam.
Great, thanks, Diego. That was great. Yes, and yes, again, thank you, New York Ag and Markets, for the funding that really let us push this work through. So couldn't have done it without it. So now with that, we're going to pass it over to Matt to talk about what is going on farm, what's the economic impact, and what do you see going forward? So.
Oh, thank you. I'm just going to share my screen. Give me 1 second. Excellent. All right, so my talk is going to dovetail nicely with Diego's. I'm going to take a big step back and think about what's going on a national scale rather than in the particular study that we're looking at. I'm coming fresh out of the USDA where we're not actually allowed to talk about unpublished research yet. So I don't have that in the slides, but I'm going to also try to sprinkle in some of the economic findings that are coming out of that study with Diego. There's a few slides where I'll talk about it at the national level, but I'll also bring in some of the findings that we have from our original research. So yeah, just a little background on me. I spent the last 8 years in the USDA between their animal products and cost of production group and their food economics division, looking at issues having to do with natural disasters, biological disasters, and animal markets, and then just look directly at forecasting techniques for food prices along the supply chain. So those are some of the perspectives I'm going to be bringing, more high level, national level scale stuff. There's a few people in these office hours that are going to be much more capable of directly answering questions about dairy, and particularly local production within the New York State system. All right. So with that, what I want to do for a little bit of framing is point out that this disease has been present among poultry and egg producers for the last 2 years. Before that, we had a massive outbreak in 2015 and another one that caused large market disruptions in 2004. All that to say, we have a lot of experience with HPAI and poultry. We don't have as much experience in dairy. We'll try to draw the relevant lessons from those poultry outbreaks to dairy, but also noticing some huge differences. And I'll go through that in the next slide. So when we're looking at poultry producers, what are we looking at? The big thing is that this is called highly pathogenic avian influenza because it causes mortality rates in excess of 75% among poultry birds. So how does APHIS control that? They depopulate an entire house once the disease has been identified, and then they indemnify all the birds. The producers have a strong incentive to immediately report outbreaks, and so they have great information about where the infection is, where the infection isn't. Sam touched on how this is an ongoing issue within dairy herds. There may be better and worse ways to collect information. For poultry birds, your incentive is to get to APHIS as quickly as possible to make sure that your population is depopulated, the disease doesn't spread, and you receive your full amount of your indemnification. From poultry and eggs, there was huge concerns about food safety, and not just among domestic consumers, but also internationally. So the affected animals did not enter the food system. That's, I think, just good practice across, regardless of what species you're looking at. But also for international consumers, most countries impose some sort of trade restriction once HPAI is identified among poultry birds. These trade restrictions have taken a lot of different forms over the different years and have had different extents from national to state level to county to small little regions. And then also, this has spurred a domestic monitoring system that's robust. They collect data not just on domestic commercial producers, but also backyard, flocks, and wild animals. All this together provides a very complete picture, not just of the economic losses to producers, but also the prevalence and disease pressure that these producers are facing in the system. Lastly, and what I'm going to spend some time on today is market distortions. When you lose a lot of animals or you lose trade access, prices might change in response to that. So in some of these outbreaks, we've lost upwards of 10% of our domestic poultry flocks of different types, whether that's turkeys and eggs, mostly in turkeys and eggs. And that introduces scarcity. That means the prices of eggs went through the roof when we had these huge HPAI outbreaks recently. Similarly, when we lost international trade access, the price of chicken meat plummeted because we had fewer consumers available to consume that meat, and a large fraction was exported. So poultry has been examining the economic consequences. Poultry has been around for a while. Current research is delving into things like what is the best regionalization policy? These very specific, nuanced questions that aren't as integral or crucial as some of the basic questions about how the disease moves around, What do we think about price movements, things like that. Instead, we're down to very specific questions. For cattle, we're still figuring out some of the basics. Okay, so just pointing out some of the crucial differences between HPAI and cattle versus birds. In birds, we're seeing, by definition, mortality rates have to exceed 75%. Otherwise, it's categorized as low path avian influenza. Mortality rates among cattle is somewhere around 2%. So we're not seeing the death losses that we're seeing in poultry, but we may be seeing other forms of losses that we should be looking for. As I touched on earlier, reporting incentives are different. If you are indemnified at 100% for all your poultry birds, the disease is likely to cause a very high level of mortality, very strong incentive to immediately report to APHIS. And it's very obvious. It's very easy to tell when you have highly pathogenic avian influenza. This just looks different for cattle producers. Third, dairy cattle live a lot longer. So you may have a loss of poultry birds and recover, depending on the species, between 6 weeks and a few months. Dairy cattle take a lot longer to replace, and any sort of persistent production impacts, like Diego showed on his last slide, are something that are going to be different. We're going to have to take in consideration, are there long-term effects on milk production, reproduction, anything that affects the producer's bottom line. And as of right now, the World Animal Organization for Animal Health their terrestrial guidelines do not support the imposition of trade restrictions on dairy products in response to high path avian influenza. This is in stark contrast to what's going on with the poultry birds, or with poultry and eggs. And then Sam did a much better job of talking through this than I'm going to, but how the virus arrives at facilities is going to be different. For poultry birds, this is largely being introduced through wild birds, whereas fomites or inanimate objects, labor, things like that might be moving the disease between dairy facilities. All right, so Sam already showed this, so I'm just going to bring it up quickly. This is a relatively new outbreak. We have about 190 cases in 13 states that have all cropped up over the last few months. And again, in contrast to poultry production, since 2022, HPAI has impacted every single state except for Louisiana, Hawaii, and Puerto Rico, and some of our other outlying territories. So the disease is just much more prevalent. It's impacted over 100 million birds. That's not to say that this disease is any more important, but we are going to see some economic effects and information differences between these two outbreaks. All right, and so as information comes in, I think all of the signs point to taking an adaptive approach. We're going to come to better understand what good biosecurity means. Does that mean protecting your facilities from wildlife, or carefully controlling which labor comes on and off the facility? It sounds like we're leaning towards making sure that we're very careful with equipment and labor movements rather than controlling wild animal movements. Transmission information about transmission is coming in real fast. I learned some things from the previous two presentations I didn't know before I showed up here. So I think understanding that better, how it moves within the facility and then between facilities, is going to be critically important for thinking about the best and right level of biosecurity investment. One thing that has come up in our study that Diego touched on, we're looking at a single facility. There may be important differences between facilities, both in terms of how the disease transmits, but also the economic impacts. There may be some important things like differences and changes in milk production, removals that have to do with the natural environment, the cows themselves, and management practices that would make the economic consequences of having an HPAI outbreak on your facility different. And then I think all of the federal agencies, as well as our other two speakers, touched on this. Information is very valuable in this system. Both CDC and USDA are spending huge amounts of money to improve our information resources to help support decision making. Okay, so what have we seen in terms of the costs that we think are most important here? This is what we've been able to come up with in our study at Cornell. If any members in the audience have thoughts about things we're missing, I would be very interested to hear in terms of what sort of costs are most important to dairy producers. The first is milk losses. As Diego showed, affected cows are losing somewhere around 13 kilograms of production per day, and that effect seems to be persistent. So we're losing a substantial fraction of milk from these herds. Another recently published paper estimates somewhere between 20 and 100% on a per cow basis of milk losses. And we're seeing that in our study too. There may be some stark heterogeneity or unexplained variation in how much cows lose. The second cost is going to be from removals. Cows that are less productive may need to be removed for economic reasons. They may just not be able to contribute to the production process any longer and therefore need to be replaced. Here, what we've thought, or what the current economic literature points to, is estimating this as the difference between the cost of a replacement cow and its sale value. This is going to differ for each farm. I just drew some average numbers from AMS. The cost of the new cow, they estimate around $2,000, sale value around $200, and you're going to have a net loss per removed cow of about $2,000. In our case study we're doing here, we're seeing increased removal rates somewhere in the neighborhood of between 4 and 5 times as many infected cattle are removed as healthy cattle. So this is substantial. One thing I'm interested in, if anyone has any opinions on this, is are there other adjustment costs just than replacing the animal that are associated with removals that might increase this financial burden on producers? And again, this is a starting point. We need more information, I think, to drill down these estimates into a more nationally representative cost per facility or cost per cow that comes with HPAI. We have case studies, which are a great starting point, but ultimately what we would want is something that's nationally representative. These then feed into APHIS's indemnity programs and other programs that they're rolling out. Okay, so what's USDA doing about the high path avian influenza situation? I'm guessing Sam touched on this during your last meeting, but they rolled out about $800 million in additional funding for HPAI and cattle. Specifically, this adds to the $1.3 billion that was already authorized for HPAI and poultry. HPAI in poultry is very expensive, and this about doubles the contributed resources. This doesn't include the additional funds that CDC and FDA are also contributing to HPAI research and mitigation efforts. APHIS is allowed to regulate commerce between states, and they have imposed restrictions, testing restrictions on cattle being moved between states. Intrastate commerce or within state commerce has to be regulated by the state level entities. And then there are a slew of covered activities. AVMA and a few other groups have done a really nice job of synthesizing and reporting all these. I listed all these out, but I think it suffices to say that the efforts for directly controlling the disease and better understanding it are buried, and these resources need to be divvied up across those separate efforts. Okay, for practitioners, I think the relevant thing to point out from this slide is funds come through ELAP. That is the Emergency Livestock, Honeybee, and Farm-Raised Fish Disaster Assistance Program, or Livestock Assistance Program. And it has limited funding, but it has committed about $28,000 per dairy to improve biosecurity. This includes testing and a whole slew of other activities. It is important to note that that is not a direct payment for owning a dairy and controlling HPAI. These would be contingent on activities, size of the dairy, and other conditions. And CDC is also contributing about $93 million to support human health research and testing. So I'll start with the punchline. We're going to move into market impacts of HPAIs. We're scaling up from the facility level thoughts about what might be economically changing to scaling up to a national picture. Market impacts to date in terms of wholesale, retail markets, and trade have been small. I don't have great information on upstream replacement cow markets. Anecdotally, the prices for these cattle are going up. The AMS reports are a little outdated right now, and the relevant category is in A, or they haven't reported for August. So if I see any sort of economic movement or any movement in the national level figures, that would be where I would be expecting it from. About 18% of dairy products are exported, and this is important because if any trade restrictions do come to pass, this could have very large impacts on domestic producers and prices. Something I wanted to point out, California and Wisconsin, two of the largest producing states to date, do not have an infection, and neither does New York, which is highly relevant to this group as well. And then I think, as Diego nicely touched on, most foods are pasteurized, and this is going to be important from a food safety perspective. Okay, and so the World Organization for Animal Health has yet to place any sort of restrictions on dairy trade. This is their official take on guidance for dairy exports. Both the cattle and their dairy products, there's no guidelines for restrictions. That's not to say that individual companies or individual importing entities within those countries couldn't avoid US products because they viewed them as more risky. So we should check the data to make sure there's not a decentralized or private sector response to avian influenza. So first thing to look for is an export response. And here I've plotted data from 2015 through the last month of exports of dairy products. Simply put, there is not a substantial response in dairy exports to date. We do see a downward trend here, but it's well within historical ranges and generally follows the trend of the past few years. If anything, it's probably still declining from the highs in that the post-COVID kind of inflationary period. Next, we would want to see if there are any sort of price responses in the retail and wholesale sectors. So here we have wholesale prices as measured by the PPI reported by the Bureau of Labor Statistics, and then the rural retail CPI. One thing to note is we would expect that wholesale prices would absorb much of the changes in any sort of production effect of HPAI, but the retail sector may absorb changes in consumer attitudes. I put up the USDA food dollar here. I don't have a appropriate attribution there, but it designates the amount of costs that go to each of the contributors to dairy production. And this is here we have agribusiness, and then on the right we have farm production. These are small, so we don't necessarily expect a strong link between wholesale and retail dairy markets. So these two can move independently. And the story here is that we're not seeing much of anything. If at all, we've seen slight price increases. So we do not see consumers responding to something like a food safety scare or something like that, where we would potentially expect prices to move much more rapidly. Okay, and then here's a map from NASS showing where milk production is most concentrated. And we have seen that both New York, Pennsylvania, Wisconsin, California have remained relatively unaffected. If we were looking for something that might change the situation in terms of what national markets are doing for dairy products, I think infections in any of these regions or all these regions would be very likely to precede a change in dairy markets. CDC has shown interest in HPAI in cattle because it has successfully transmitted to on-farm labor a few times. And some of these disease outbreaks are enormously expensive. So even if it's a low probability that we have transmission to farm labor and then secondary transmission to other folks and it becomes an outbreak, even if there's a small probability of that, the costs are enormous. The value statistical life. So if we expected to lose 100 folks at $13 million a piece, we're looking at over $1 billion in losses. So this, even if it's a very low probability, the consequences of a disease outbreak are just enormous. Even morbidity losses, so the overall cost of influenza, not the strain of influenza, but all influenzas across the United States, has been estimated at $11 billion. If you compound that with a relatively virulent strain, we can see we would expect a much higher rate of losses. But these are always difficult to predict. I think we can all go back to the beginning of COVID, where a lot of predictions were made in terms of how the disease would spread, what the economic consequences would have been. Most of them were wildly wrong. It's very hard to know what these viruses would do in a human population. So I'll probably leave off the summary. I think we only have a few minutes left, so I'll leave these up here. They just recap my thoughts and then turn it back over to Sam.
Great, thanks. That's great information, Matt. Good outlook. So, well, it'll be interesting to see how things happen, right? Progress next year if we see this happen again, and how that impacts some of those other states. So we are getting up to the top of the hour. There were some submitted questions, but I'll see, are there any burning 1 or 2 questions from the crowd for anybody on the panel? If you have one, feel free to unmute yourself. Looking to see, everyone is pretty quiet.
And there's been nothing in the chat.
Yeah. So then overall, I mean, I think we answered a lot of the questions that came in. I guess we'll do the long, well, one testing question that came in maybe for Diego. Someone asked about the PCR testing. Is that done in a BSL-2 or does it need to be done in a BSL-3 lab? For
most labs, I think, do it in the BSL-2. Here we move the samples into the BSL-3 lab, and then as soon as we add the lysis buffer that will inactivate the virus, we move the sample out of the BSL-3 lab.
Right. I guess it's kind of one of those things where it's not quite confirmed, right? But once it's confirmed,
Yes.
it becomes the BSL-3 agent, and then
yes, that's correct.
Yep. And do we know, we talked about Colorado. This is another interesting thing. Colorado is doing mandatory testing. Is there any voluntary testing that we know going on in New York or in the Northeast for high path? Or is that right now kind of quiet? People are just submitting sample or would have submitted a sample if they saw some evidence of disease on farm.
There's no, regular surveillance happening in New York, and I'm not aware of any other states in the Northeast. We have been doing, this is the fair season, so we are doing a lot of testing here at the HTC pre-fair movement. So animals need to be tested before they are moved to the fairs. That's what we are doing, a pretty good number of tests right now, or have been doing the last month.
Also, that USDA herd status program, New York doesn't have any states participating in that yet either.
So we'll watch how things evolve. Well, we've reached the top of the hour, so I know if you have more questions, feel free to reach out to us and shoot us an email. We're going to be having another office hour, though. It won't be HPAI focused. I'll let you know when the next one of those comes out, but we will have a general food safety focused one I believe on September 25th, right, Alex? Yeah. So
Correct.
great.
And the topic will be food fraud, and the presenter will be Dan McCarthy from New York State Ag and Markets.
So I want to thank our Matt and Diego for sharing information. Thank you, Robert, for also jumping on, and Al. And we look forward to seeing everyone next time. So take care.